Well, good afternoon and welcome to our daily briefing brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, and along with my co-host, Dr. John Raymond, president of the Medical College, we invite you to join us for 19 minutes of a fact-filled update on the health and economic impacts of COVID-19. So we'll start off as we usually do with a update from Dr. Raymond on the healthcare status, and then we've collected a David Letterman-like top 10 list of questions to close out the week that we'll ask Dr. Raymond. And of course, your questions are also welcome. And I should note that this podcast is powered by Aurora WDC. Dr. Raymond, it's all yours.
Yeah, thanks, Tim, and good afternoon, everyone. This first slide summarizes various indicators of COVID-19, and I'll run through these quickly. The doubling time for COVID-19 in Wisconsin has stretched out to 12.8 days and to 16.7 days in Milwaukee. And the daily growth rates averaged over the last 7 days for Wisconsin are 4.6% and 3.3% in Milwaukee. Those are about stable for earlier in the week. The positive tests, however, in Wisconsin rose by 12.7% and 17% in Wisconsin and Milwaukee, respectively, and that's a trend that we need to watch. The number of positive tests also increased to a new high in Wisconsin of 460, and there were 104 new positive tests in Milwaukee. Testing capacity is increasing in Wisconsin. The ICU and ventilator capacity remains adequate, and the PPE trends are stable both in Wisconsin and in Milwaukee. Can I have the next slide, please? This slide highlights how much the capacity for testing for COVID-19 has increased in Wisconsin over the last several weeks, as shown by the blue line. Now, the capacity has increased very significantly to about 11,000 per day, which is approaching the Badger bounce back goal of at least 85,000 tests per week. So I think this is good news and in part accounts for the increase in the number of COVID-19 positive tests. Next slide, please. This slide shows the daily incidence of COVID-19 in Wisconsin since March 12th. And you know, the trend showed primarily that we've reached an equilibrium with COVID-19, although over the last week, as our testing capacity has improved, there's also been an increase in positive cases. Again, I attribute those primarily to our increased testing capacity and perhaps to increased surveillance and vigilance in institutional settings. And with that, I'll turn it back over to Tim.
Thank you, Dr. Raymond. Again, appreciative of the update and the insights that you provide. And so as we close out the week, I thought a good way to do that would be to walk through a list of top 10 questions that I've gotten and others have fed in over the course of our discussions here. And so I thought I'd do it in a little bit of Letterman fashion, and we'll start with 10 and work to 1. So number 10 would be, what makes COVID-19 so different from the flu?
Yeah, it's a great question, Tim, and it's one that continues to come up. There are many things that are different about the viruses. So first of all, COVID-19 is from a completely different family of viruses than the flu. It's much more infectious, it's more deadly, and it can spread when people have no symptoms. And unlike the flu, it can attack many organs in the body, not just the lungs, but the heart, kidneys, and liver. So that's what makes it such a difficult pandemic for us to contain.
Question number 9, what are the top 3 actions the public should take to curb the COVID spread?
Yeah, thanks, Tim. I think people are already doing them. That's why we've been able to flatten the curve. But just to remind people, limit the circle of people that you interact with. In other words, stay at home if you can. Maintain that 6-foot space bubble when interacting with people who don't live in your home, and wash hands and touch surfaces frequently.
All right, number 8, what are the best indicators to assess where we are in dealing with COVID-19?
Wow, Tim, that's such an important question, and it's difficult to answer because we have so much data available to us. Yeah. So obviously we want to follow the gating criteria of the Badger bounce back, but some of those are evolving and haven't been specified yet. I think from a healthcare perspective, I'd say that right now we want to monitor our ICU bed count in the daily deaths from COVID-19. If we continue to have a rising trend of positive COVID-19 tests, we might also want to follow the number of hospitalizations that we're having to just take a look out maybe a week or 10 days from where we are. And we've been following other important metrics such as the number of new cases, doubling times, and growth rates. I think all of those are important. And then finally, as you've highlighted many times, we do need to keep track of our supply of personal protective equipment and the increasing ability that we have to test anybody who has a symptom or wants to have a test on demand.
Thank you. Number 7, what is the most promising path to a vaccine?
Wow, Tim, that's a hard question to answer. There are now more than 120 different vaccines under development in the pipeline. And I'd say if you want to track the most promising vaccines, they kind of span the gamut from chemically inactivated COVID-19, from genetically modified coronaviruses and RNA and DNA strategies. I think the best place, the most approachable place to go for good information about the vaccine pipeline is Bill Gates' blog. That's gatesnotes.com. Now, some of my favorites in the pipeline right now are being developed by Pfizer, Oxford University, Moderna, Inovia, and Sinovac.
Thank you. And number 6, what do you think will be the most lasting change in how we interact with each other?
Well, Tim, I think there'll be many, but the handshake will no longer be a preferred greeting.
Wow, that's a big change.
That's a huge change.
Number 5, do we have the capacity and capability in southeastern Wisconsin from a health system perspective to handle COVID?
Yeah, as of this moment, we have plenty of capacity to handle COVID. And in fact, the health systems here would like to make sure that everyone knows that we're here to take care of everything, that you have all your chronic illnesses and acute illnesses. We have safe environments for you to come in as a patient, and we would encourage you to do that. And I know that many of the health systems are going to be resuming face-to-face office visits and some non-emergent procedures as well. I also want to make sure that everyone here understands the health systems that we have in Wisconsin, not just here in southeastern Wisconsin, but across the state, are amongst the best in the country, and I would even argue in the world. We have outstanding health care here. And the good news for Milwaukee is that our major health systems have been working together and cooperating in unprecedented ways. So yeah, I think we do have the capacity.
Good. Number 4, what's likely to happen over the summer and into the fall with COVID-19?
Wow, Tim, this is such a critical question, and no one really has a crystal ball. All of us hope that the pandemic will fade somewhat and maybe even disappear. But even if it does, we need to be prepared for a second wave in the autumn. And that could be challenging because it could coincide with influenza season, which could strain the bed capacity of our hospitals. And there's always a possibility that we could have boomerang waves coming back at us from nearby states or from the countries in the Southern Hemisphere.
Wow. Number 3, what's the best way to protect the most vulnerable going forward?
Yeah, another excellent question, Tim. I think there are 3 things we can do. First, we need to direct a lot of our resources to protecting individuals in group living settings like long-term care facilities, dormitories, and prisons, and maybe even extend that capacity to some of our business settings where we have outbreaks. Second, I think we need to encourage people in the high-risk groups to diligently practice social distancing and hand hygiene, all the things that we've done to flatten the curve. And then third of all of us, whether we're in a high-risk group or not, need to practice social distancing because that'll help us protect the ones that we love who might be in high-risk groups.
Well, thank you. And then number 2, what have you learned about leading the Medical College of Wisconsin during this crisis?
Oh, thanks so much for asking, Tim. I'm so honored to be part of the MCW family. As you know, it's been an anchor institution in Milwaukee and in Wisconsin for 127 years. And I think especially during this crisis, we've been looked to as a source of objectivity and truth because there's so much information out there. that it often is helpful to have somebody who's dispassionate, objective, try to critique the information. And the crisis also helped me to understand in very tangible ways that we have a remarkably resilient and talented workforce of incredible people here who are dedicated to all 4 of our missions of research, clinical care, teaching, and community engagement. And then, unfortunately, as a business leader, I've learned how very fragile our revenues are, in as much as we depend on a very small slice of our clinical activity to generate the positive margin that supports everything else that we do. So it's going to be incumbent on us as we come out of this crisis, like every business, to think of ways that we can be more efficient and to do things differently and better.
Thank you. And then the number one question, I asked you a couple of weeks ago, kind of a throwaway question about what favorite series you were watching. And you mentioned a series called Bosch. I'd never heard of it. I am now 3 seasons in on a semi binge watch and I love it. So my question to you is, what do you like most about the series Bosch?
Well, the most important thing is I enjoy watching it with my wife, and we have very different tastes in streaming, and that's one show that we really enjoy watching together. For people that don't know, Bosch is a detective show with very interesting, complicated plots, well-developed characters, and Bosch himself is an enigma. He's a brilliant but deeply flawed individual who usually finds a good path through moral dilemmas. So I really like and recommend the show.
Great description. It's almost like a multi-level chess game, as you say, with character built in. It's really a good, enjoyable show. So thank you for turning me on to that, and hopefully other people will get to see it. So, Chris, we've got some time left. Let's open it up for questions.
Yes, absolutely. Dr. Raymond, we've talked a lot about turning the dial on the economy, and I imagine that's also true in the healthcare field. Is MCW sort of turning the dial on what sort of procedures and appointments you can perform right now that maybe you weren't doing a couple weeks ago?
We are, but everybody needs to understand we're a separate organization from our health system, so we really depend on the strategic plans and the comfort level of our health systems to start turning that dial. Both Children's and Froedtert have plans to very slowly turn up the dial for non-emergent surgical procedures and primary care visits and chronic care. They're going to do that responsibly to maintain a safe environment for everybody. But I can tell you that our faculty are really eager to get back to work.
What should people know in terms of taking precautions when they're visiting a healthcare facility now?
Yeah, first of all, I would say the healthcare facilities are probably the safest places that you can go. And I'm sure some of our colleagues in industry would say that their factories are, because we're all doing the same things to protect the people that are in the facilities. But I'd say it's safe to come here, and we're probably leading the way just in terms of protecting the people in our environment. So be prepared to wear a cloth face covering at a minimum, and to practice good hand hygiene, and maybe to have a screening when you come into our facilities.
We had a question about the idea that you described PPE supplies as adequate right now. What do you mean by that? And Tim, this might be a chance for us to maybe tease something that MMAC may be putting forth pretty soon.
Yeah, well, maybe I'll start by saying MMAC is going to have a very nice dashboard that will be tracking PPE and a number of other critical metrics for gating or turning the dial, so to speak. About half the hospitals in our region have what we would call, under normal circumstances, a shortage of one type of PPE or another. But they feel comfortable enough that the Wisconsin companies have worked hard to repair the supply chain, and that we're going to be able to continue to maintain some level of business operations outside of the crisis capability. And again, I want to highlight the great work that the MMAC has done to try to secure that supply chain.
Thank you, Dr. Raymond. And I know we have on our website what we're calling a PPE exchange, and it allows people looking for PPE to match up with those that are supplying it. And as Dr. Raymond knows well, because we've tracked this, as the PPE supply chain has gotten better, but certainly not over the hump for healthcare institutions, as companies start to ramp up and come back to work, their employees are going to be looking for PPE equipment on their own. And so there's going to be a growing demand for that type of coverage as we continue to go forward for the foreseeable future. And I'm sure most people saw yesterday now that if you're flying with an airline now, it's required that you wear a mask on a flight. And so the pressure on that supply chain is going to continue to grow. The good thing about ingenuity and productivity here is that people are going to step up to the task of making that. And Dr. Raymond and I both saw today the announcement from Husco and their Mask Up Task Force as they've worked with Briggs & Stratton and Quad and others to build a reusable, design, build, and produce a reusable face mask that is now being made in significant numbers for our healthcare providers. And I think that's a great example of what can be done.
Great. Another question. I know a lot of parents are looking forward to the possibility of in-person school returning in the fall, and we don't quite know what that might look like. But do you foresee the possibility of face coverings being required for students as they go back to school in the fall, on the predicated on the idea that that's actually going to happen?
In theory, it's a good idea, but I'd like to see how we could enforce having school-age children wear face coverings. I just don't think it's practical.
But another question about what you mentioned earlier about the idea of the virus reacting to heat in the summer. I know there's a lot of conflicting information out there, and we may just not know, as you may have alluded to earlier.
We don't know, but what I would say is the virus now is spreading through the southern hemisphere where it's warm this time of year, and we can watch to see what happens there. But I don't think that just because we'll have summer in Wisconsin that the virus will be completely extinguished. We're going to be living with it until we have a vaccine.
Is it helpful at all that we know that some other strands of flu that have similar symptoms are presumably going to fade in the summer, and that if you're experiencing these symptoms, you may know that at least you're at more risk for COVID-19, where there's some confusion potentially about that in the winter?
Well, I think in the summer, there aren't many viruses that cause respiratory illnesses, but we all have allergies, and that may be confusing as well. But again, this is the problem with COVID-19 is that many people don't feel that bad, and they're very, very contagious. So that problem is going to be one that's going to be with us throughout the summer.
We've also had a lot of questions continuing about serological testing and antibodies. What's the status of that for folks who may not have seen your previous answers about that?
Yeah, I'm very optimistic that we'll have well-validated serological testing available in high capacity here in Wisconsin in a very short period of time. That's important for us because it'll give us some insight into what's actually going on in our population. And it will answer some of the questions about how many people have been exposed to the COVID-19 virus that we may not even know about. So I think within the next month, people are going to be very pleased with the progress that we make.
Thanks, Dr. Raymond, and thanks to everybody who asked a question today.
Yes, and not to contradict one of Dr. Raymond's answers, but when it comes to enforcing school-age children to wear masks, I know very much how we could do that. Just tell them they can't wear masks, and then they will. So again, Dr. Raymond, thank you for the in-depth information and the answers to the top 10 questions. I hope everybody has a safe and warm weekend, and we'll look forward to picking this up again next week. So again, thanks for the leadership and thanks for the role of the medical college.
Thanks, Tim.